All right, we're recording. Dr. Eva Lassey, Doctor of Physical Therapy and founder of drsensory.com, is a leading expert in the intersection of sensory and motor disorders with mental health. She deeply understands how physical health influences mental well-being, offering a unique perspective on the body-mind connection. Dr. Eva's extensive experience includes treating individuals with autism, cerebral palsy, PTSD, and neuromuscular disorders. Her holistic approach recognizes that sensory processing and motor function are critical components of overall health. Her insights into these physical aspects can illuminate their mental impact on mental health, making her a valuable voice in discussions about comprehensive care. Passionate about mental health, Dr. Eva has dedicated her career to integrating physical and mental health care. Her research and clinical practice focus on helping individuals of all ages overcome physical challenges that can exacerbate mental health conditions, enabling them to lead more fulfilling lives. In addition to her professional expertise, Dr. Eva's work is informed by her spiritual beliefs, offering a perspective on how faith and spirituality can play a role in healing and wellness. This aligns perfectly with the themes explored on the Empowering Minds Mental Health podcast. Welcome, Dr. Lassey.
Thank you, Jennifer. I appreciate you having me on, and I'm very, very excited about this.
Absolutely. Thank you for making this commitment to come on. All right,
Thank you.
so we're going to jump right into the questions. And my first question today, can you explain how physical therapy can improve mental health?
Yes. Okay. I am a physical therapist, and a big part of that, something that I feel like a lot of people don't realize is how interconnected it is with your mental health. So sometimes when you have one but you don't have the other, something is misaligned and you know it. And you'll kind of see it. This is my biggest example here is when you ask someone, "How are you?" and they're answering you honestly and truthfully. So, how many times have you heard, "How are you?" And then you'll hear the other person, "Oh, I'm fine, but my back has been hurting me, or my sciatica is acting up, or gosh, my head's been really hurting." Those are the things you'll hear. Whereas on the contrary, on the opposite side, what you can also hear is with the answer of, "I'm great. I've been hiking. I'm good. My grandchildren are in town. Like I've been getting outside." So you'll see that complete shift. So think about how drastic that difference is. And that is the beautiful thing. They are completely interconnected. And the cycle that I hope to help break is I want people to realize that this cycle needs to be broken of a physical ailment, then affecting the mental. That mental creates even a worse physical state because you're not getting outside, you're not taking care of yourself physically. And then that leads to your worst mental mood. Like you get anxiety and depression. You don't
Mhm,
want to socialize. You don't want to go outside. You end up
mhm.
isolating in the home alone on your couch and not doing what you want to do. And that is the sad part. And that is a cycle that has to break for everyone.
Absolutely. So
Yeah.
I can personally attest the physical therapy did, well, it still continues to help me with my mental health. So as a person who has been diagnosed with a neuroskeletal disorder and some other things, physical therapy, it really like gives me a mental boost. My therapist said, I've never seen anyone so happy to come to
Yeah.
physical therapy. And I'm like, just the simple exercise, it helps me to stop focusing on whatever chronic pain that I'm dealing with. So I look forward to it. He's like, I don't see that a lot. Nobody's
Isn't
very
that
excited.
beautiful?
I love physical therapy. It's
Yeah, there is something to say about like the endorphins that exercise gives off. That is
Mhm,
something obviously on its own, but there is something else about like being with someone who can actually listen to you. They understand the physical
mhm.
ailments you're going through. They can relate to you, and then you're free to almost express where you are, like where's your headspace at.
Yeah,
So that's beautiful.
absolutely. We have a great relationship.
That's awesome.
Yeah,
Yay, you're a physical therapist.
I love him.
I,
All
oh, I
right.
love that.
So my next question, what common physical challenges can affect a person's mental well-being?
Oh, this is a loaded question in the sense of everyone is different.
Yeah.
So different in the sense of whether what you're capable of doing and what your body's capable of doing to maybe it's how you were born and what deficits you were born with initially, like
Mhm.
maybe a diagnosis of sorts, or you ended up having something that happened to you that then contributed to, for example, chronic pain syndrome. That is a real thing for people.
Serious.
Working in a hospital, I can see that all of the time. That is in almost everybody's medical history. You'll see chronic pain. And that's a sad that's a sad thing because it's it leads to frustration and depression and it leads people into a downward spiral of I'm in pain, so I can't be well. And that leads you it's crazy how many things that can lead to and not just physical, but also like they're not in a headspace to participate in anything, to have a conversation. They're in a spot where if anyone approaches them, it's I don't feel like it. I don't want to. Everything hurts. Like that is a sad place to be. And that hopelessness and that frustration that comes with chronic pain,
Mhm.
that that needs to stop somewhere for people to thrive. It just breaks my heart that that is a place that people can sit and live in. But not just that, when you're also looking at like post-op, let's say someone had surgery and now they don't have the mobility that they had before. You're looking at they can't do what they needed to do before. They can't participate in activities they did. They can't go hang out with their friends and they can't walk their dog. I mean, you're looking at this limited mobility as you'll notice these people tend to isolate.
Mhm.
They tend to stay at home. They tend to gain more weight because they can't do what they did before. And now you're looking at body image. That's a mental state of its own. I mean,
Yes.
having poor body image, yeah. And you end up in this depressed, isolated, just sad spot. And this is why I am a big believer, especially I still work in a hospital and I always recommend post-op care to patients. I always say, go see your physical therapist, okay? Get a goal in place, get some things in place. It helps them stay motivated and it helps them take steps to get back to where they were before. Those are just two examples. You can always look at fatigue, like general, if you'll notice some people, have you ever had days where you don't have the energy? You're done. Like
All the
there
time.
is, yes, there's just, I can't even get up anymore. I'm
You
just
can.
going to sit here. That happens so much.
It
It's
does.
crazy how often that is. And to me, what I've realized is sometimes it's not just your physical. You do need to probably get checked out and make sure it's not a deficiency in like your B vitamins. That can lead to severe
Yes.
fatigue. Or let's say, what's another one? Anemia. Okay. So let's
Mhm.
say your blood is not able to carry all of the oxygen and nutrients that you need. Okay, so that's an issue and that's going to present with severe fatigue. I've had patients who stayed at home for 5, 6 days, sometimes longer, because they didn't have the energy and someone had to cook for them and bring them meals, and this isn't the normal level. But now they're depressed, and if they had gotten checked out and realized their hemoglobin was sitting at a 6.8 or a 7.4, and it's nowhere near where it needs to be, like that's something that can be taken care of initially. So it's hard to keep a positive outlook when you're so fatigued.
Mhm.
And if it's not a medical reason, it could be physical. It could be that you just haven't taken a walk in a while.
Mhm.
When's the last time you got outside, got natural vitamin D, or got your muscles
Yeah.
moving so they don't hurt and you feel like
Mhm.
you have the strength to continue? And so just breaking that. And that's why I see PT as a holistic approach. You don't just look at the person as their physical body. You look at their mental and you look at we'll get into this a little later, but also their like spiritual or whether they have like hope in
Mhm.
something. So, yep, that is why it's like a whole holistic thing.
Absolutely. So I was born with congenital fusions in my neck and spine. And so, I kind of dealt with it even as a child. And it limited me to a certain degree. Like I love to golf. My son was like 12 or so, and he started kind of showing me the ropes, and I really fell in love with golf. But over time, I wasn't able to really do golf. like I used to or like I wanted to. So that
Right.
led me with issues of like kind of having like low self-esteem, like, I can't do this anymore. So I just, just very limited, just going through things again, back through mental health. So again, that's where PT came in because it was able to like, kind of help retrain my muscles and different things like that, kind of rebuild my confidence. But my therapist also kept saying, think it's something else. I'm going to refer you back to your ortho doctor. So when I went to my ortho doctor, I'm like, yeah, sometimes my mood is very low. So they ran labs and it was determined that I was deficient in potassium and vitamin D3.
There you go.
So I have been on this big kick with my vitamin D3 and coconut water and different things to incorporate these nutrients that my body needs. And it's really made a difference, really physically and mentally. So yeah,
Yes.
absolutely. I love the holistic
It
approach.
Yes, it is so interconnected. You'll even notice, it's kind of funny. My husband, he always says when he comes to a place where it's rainy or there's not enough sun, he's like, I just feel so depressed. And if you'll notice, yeah, the Pacific Northwest, especially when it's so many days without sun, if they don't have the right vitamin D that they need, they'll notice that they're in a sad place. They're in a
Yep,
depressed place. They're not where they want to be. And so that is just something to I'm a big believer in go to your medical appointments and go get your lab draws. Figure it out. Know where you are and compare that over time and see where you're going and where how your body's doing.
absolutely. It's very gloomy here today. And I was like,
Here too.
I need some energy. And I was like, well, wait, I'm excited because I have a podcast interview today, so that's gonna be good. So
That's awesome. That's
I got
so
my
I love
coconut
that.
water and stuff and got my natural
Yeah.
energy going. So I've been, doing pretty
Yeah.
well. Still a little gloomy on the outside, but my peace and my mental well-being is shining. So I'm happy for
Yep.
that. Yeah,
Don't forget your multivitamins and they do help.
absolutely. They do. They really
Yeah.
do. Yep. All right.
I love it.
So my next question. How do sensory issues relate to conditions like anxiety or depression?
So I have been focusing my career into sensory processing disorders, and this is why myself and a couple others started Dr. Sensory, and we are focusing on not just everybody, but primarily children because this is where patterns start.
Mm-hmm.
Childhood. This is where parents can have an effect on their children to help their trajectory into
Mm-hmm.
life to thrive. You can teach those patterns of what they need to do to then, as they get older, to not get into those patterns, right?
Mm-hmm.
And so, with sensory issues, what you look at is some people are sensory seekers, some are sensory avoiders, and some are somewhere in between. How I like to say it is with if you have a diagnosis, like if you have autism and you have
Mm-hmm.
ADHD, more times than not, you are somewhere on a sensory seeker versus sensory avoider on like many things, whether touch or like auditory or all of these things, right? You're somewhere on that spectrum of whether you love all of that or you cannot stand it and it puts your body into like a heightened state of where you can't handle it anymore. And so focusing on like for example if someone has severe anxiety or depression and they can do more of a deeper dive into what triggers that like what situation are you in when that is highly triggered. So a lot of people will say, well, I get a lot of anxiety when I have to go to the grocery store and be around a lot of people and there's
Mm-hmm.
bright lights and everything. Okay,
Mm-hmm.
well, it could you could help that potentially, that obviously there's so many reasons for it and some people do truly need medication, but sometimes as an adult you'll realize that you never caught on to that before. Okay, it's bright lights, it's the sound of so many people around me, like, and you could be a sensory avoider where you don't like that and it puts your body, it's too much for your body to handle. And like with that sensory integration, like you're processing all of that and you're like, oh, this is so much. And so that puts you into a place where you don't like doing that. And so you stay home and you get into a cycle of deeper depression. And that is where, if you can figure out where are you? Where are you on that sensory spectrum? Do you like bright lights? Do you thrive in that? You
Mm-hmm.
know, are you doing okay in that? Or and if you love that, but you're spending too much time at home, without that, okay, well, that could be leading to some depression there, some anxiety there. Whereas on the other spectrum, okay, let's say you have big family gatherings and big dinners, and that sparks your anxiety, depression. So you end up isolating away from people because you feel like it triggers it. Okay, if you're that person, what about instead of isolating, but instead find one person where you can sit in a quiet room, or you don't have to go to a coffee shop where it's loud. Instead, have them come to your home where you have dim lighting and you're able to just focus on each other, but still build those connections as humans, as people. And that is so important. I believe that we're created for community and we're created to be among other people. And so finding ways to do that can help with not getting into that anxiety and depression and all of that. Does that kind of make sense a little bit?
It does. And
Yeah.
it's so ironic that you said that because even as a small child, family gatherings, like family reunions, more like
Mm-hmm.
bigger size, they would give me anxiety. And so everyone is like playing and uh, eating and having a good time, and someone would say, "Where's where's Jenny? I've left everyone. I've isolated. I'm over in the
Yes, there you
over in
go.
the
You
corner." And I used to just think, and then that would play on my mental health too, because I was like, gosh, I don't want them to think like something's wrong with me. But this is just, it was like overwhelming, just stimulated for me. And but
yeah.
I didn't know the words to articulate how I was feeling. I just really think some of them thought, oh, she just doesn't want to hang with us. But it wasn't that. That is a real thing. It really
Yeah,
is.
because you could totally thrive on one with each family member and be totally fine. And then
That's
put
me.
yourself with all of them and you're like, no, thank you. Like, no, thank you. I'm gonna go hide in my room now.
That
So
is true. That is, you just
yeah.
described it to the T.
I love that. So with this, what I recommend is, especially if a parent can recognize it in their children, start that early. Start helping them see like, hey, I don't like this and this is why, and they can create patterns to then help with that. Like they could be able to talk. I'm not saying you can never tolerate a family gathering, but you can create coping strategies. Some people might put on like headphones, be like, you guys, I'm not being rude. I just need some of that sound away. Or have like a
Yeah,
fidget toy where you hold on to it to help relieve some of your like
yeah.
anxiety that you start to feel. There's so many strategies, and I am a big believer in teaching those because we want everyone to thrive.
Hmm.
We have to
Absolutely.
thrive.
Yeah, yeah. I had this little clicker thing that I would keep in my
Yeah.
pocket whenever I would get a little anxious. So I would just tap it and it would just I would just mellow
Mhm.
out. And then
There you go.
yeah, working with in the classroom with children with autism, I think I did like 12 years. I was real big on like therapy seats and cushions
Hmm.
to just kind of help them calm down because I realized, especially for um, the students who were nonverbal, I knew that their brain was like just kind of in overdrive because they were trying to communicate something. So I would come with like the voice calm or the odd calm, so they could tell me, they could press a
Yeah.
button to kind of tell me this is how I'm feeling or I'm not feeling well. And so I think that's very helpful too. You mentioned autism. I always thought that was just very therapeutic for them. Yeah,
Yeah, we love
absolutely.
to teach parents like if your child is like a sensory avoider, you can create like a sensory corner for them, a quiet
Yeah,
corner of things they like, what they
yes.
need.
Mm-hmm.
Whereas a sensory seeker, you can put them on a ball or put them on a little trampoline, and they help get that out. They create a
Yeah,
strategy for that. So
absolutely.
that's what we teach at Dr. Sensory for sure.
Yeah, we'll get into Dr. Century. It sounds like you're doing a lot of great things there. So,
Yeah.
all right. So, my next question, why is it important to look at the body and mind when treating someone?
So we know this is connected, right? So we know the
Mhm,
body and mind. You're obviously one person. You are
mhm,
one entity, okay?
mhm.
And so realizing how much your mental health plays into your physical and how much your physical health plays into your mental. You obviously know when you go to physical therapy, if something happened to you, like you locked your keys in the car, you're in a bad spot, you're just not feeling good, it's a bad morning, you never had your coffee, you're just like, ugh, a bad day, that's not going to be your best workout. Like you're not going to
Right.
feel like, okay, you're like, this is hard. Okay,
Yeah.
this is a lot harder to get into the game with this.
Yeah.
So you don't know what someone's going through. And that's why having that holistic approach and
Mhm.
just looking at someone as a whole, looking at their mind and saying, like, how are you? How can I help? What are you going through? Like, is there someone you can talk to? And then addressing the physical components with that. And that's why with physical therapy, what I feel is that that becomes a person who can understand you,
Mhm.
like you've experienced it. And it honestly plays a part in changing the mindset too. So when you're optimistic about your physical health, how much does that change your mindset about your body, about your mind, about like it empowers you, right?
Mhm.
Once you decide to get better, you're changing your mental health into physical healing and vice versa. Your physical healing is turning into your mental healing as well.
Mhm.
So realizing that they're completely interconnected is such a beautiful thing because once you know that, you can have strategies in place to go from one to the other and kind of figure it out that way.
Absolutely. Medical care has changed so much, and I'm so thankful as it addresses things like cultural competence and things like that. And when I do
Mm-hmm.
my e-check-in for my physical therapy appointments, or even my regular medical appointments, there's always a component that asks about mental health.
Yes.
How's it going? It even has a section where, in the mental health part, like, how are you doing financially? Do you need assistance? Do you need food? Things like that. And financially, that can be a stressor and cause mental health things too. But I do like that component that they include your overall wellness. I love
Yes, you need to. You have to, because we all deal with all of that. We all
it.
deal with finances. We all deal with everything,
Yeah,
right? We all deal with family and passings and births and like everything, right? So we just have to look at the whole person. And I'm honestly so glad that those questionnaires include that because those are things that we need to address as well.
yeah, absolutely. All right. So my last question. How do your faith and spiritual beliefs influence your work in physical therapy?
This question to me is uh it's so interesting because it's always been such taboo to talk about your faith with your medical profession, right?
Mhm.
And so I have I am a believer and I strongly like voice that. Everyone who knows me knows that.
Mhm.
But when I work with patients at the hospital, there is a line that you can't cross. And
Right.
so but it's so funny because the patients that I see, they'll always comment on like, you're so upbeat, you're so happy. Like, what is it? Like, what, like, you just made my day, or thank you for coming to see me. Or like, you'll notice that it carries over to them. Like, they won't, for example, in a hospital, one of my biggest things is to make sure that people don't lay in bed all day. So I'll get them out of bed and make sure they're up and moving, right? And you'll notice the patients that don't want to at first, if you just
Mhm.
start with a conversation and just say, well, let's see how you do, or like, how are you doing, or what's bothering you? Sometimes it's something that you can address. Like, for example, they're concerned over their doctor, they didn't answer the questions that they needed or something, right? So, for me, when I look at the patient, I don't just look at their physical, I don't just look at their mental. There
Mhm.
is a third component. Everybody has like their soul, their spiritual being, right?
Yeah.
You're a believer, I assume. Yeah,
Absolutely.
okay. Okay.
Yes.
Okay, so I'm talking to my people. Okay. So with that, when you look at someone's spiritual being, the people that have like I hate to say this, but sometimes the people that are in like a most depressed state in a hospital and are just not doing so well, they've come
Mhm.
into that cycle and they can't get out of it because they have no hope, they have no purpose, and they have no faith.
Mhm.
And so when I dig deeper and honestly working in the ICU, that's what breaks my heart is sometimes I'll like put in little questions like, oh, do you guys have a community? Do you have faith? Have you found a church? Like I'll say things like that. And
Mhm.
it breaks my heart when I see that the ones doing not so well are usually those with no faith and no purpose. And
Mhm.
so, and I completely understand that not everyone has my belief, not everyone has your belief. Like, not everyone is going to agree with us.
Right.
And you like that doesn't change how I interact with them. That doesn't change who I am as a person with them or how I am as a medical professional. Instead, it puts me in a place of just showing compassion, love, joy, just showing like Jesus through me, right?
Yeah.
You want to show Jesus through you.
Mhm.
You don't want someone to not have what you have because you came in with a bad attitude
Right.
and they're like, "Well, I don't want what she has. She's rude." Like
Right.
that is not that
That's
is not
right.
what you want. Yeah. So my goal is everybody has the right to choose, right? We have free will. At the end of
Mhm.
the day, we have free will. But if you have that like spiritual faith component, you have something that not a lot of people do. You have a purpose. You have a like specific purpose. And you know that, the Bible specifically talks about your physical health too. Okay. So it
Yeah.
says your body is a temple and it houses the Holy Spirit, right? And so if you don't respect your body, how is the rest of you going to do well? Like how are you going to thrive in this world, participate in community? How are you going to share about Jesus? How are you going to um just live in this space, right? So I
Mhm.
think it's really funny because I always tell my husband, I was like, well, physical therapy is not something I even knew about when I was like first starting out in my education.
Mhm.
Um and like before my doctorate and now it wasn't even on my radar. I didn't realize it, but God knew better. And now as a physical therapist, do you know how much time I spent the initial career I considered? You don't get time with your patients. You get like 20 to 30 seconds to say
Mhm.
hello, goodbye, how are you, write labs, right?
Yeah.
In my career, I get to sit with you. I get to talk to you. I get to move with you. I get to share with you. We get to share stories. The amount of stories I get to hear from people, it's a beautiful thing. And, my prayer every day, and I know my husband prays about it too, is that God uses us in our jobs and our careers. And I think that that's just such a beautiful thing. And I know his plans are better than mine, and this was his plan and not mine. And so I see the beauty in it, and I'm really excited that I get to actually join the two right here in this conversation, which is
Yes.
such a in the medical career that's such taboo. So this is wonderful.
Yeah, yeah, I'm with you there. My faith has helped me tremendously in my life, in my physical health, my mental health. So I always keep Jesus
Yeah.
at the forefront of everything that I do. But in my I work part-time in mental health, and you're right. You have to there's that line you can't, cross over.
Yeah.
But I do have, like you, certain clients I have run across. They're like, it's something special about you, and you just never seem to like be in a bad mood, and I wish I could do that.
Yes.
In my days were so I just try to, even though things happen in my life, I just try to make sure that when I'm interacting with a client that I am effective and I'm putting forth my best effort to show that radiant that they see.
Yeah.
Yeah, because
It's joy.
it encourages them as well.
They
And,
see something. And
yeah,
I honestly pray that even the ones that interact with you, that they see something that they like want to know more and they can ask the questions. I, as a healthcare professional, you can't always like ask
yeah,
those questions in a way. But if they ask you, you can always say, like, I love my church. I love Jesus and he helps me. Like, you know what I mean? Like you
right,
can conversate on that topic if they initiate that. And
absolutely,
so that's just so beautiful that God even put you in that space too to be able
yeah,
to answer those questions too. So I
absolutely.
love that.
Me too. Me too. Well, I wanted to ask you something just for the viewers who will look at this later. So you've mentioned Dr. Sensory a couple of times. So I just wanted you to have a moment if you wanted to highlight your business, just in case someone may want to reach out to you for professional services or just kind of find out a bit more about your business. I definitely wanted you to highlight that.
Oh, you're so kind. Clearly you can tell I'm passionate about it. I'm
You
like
really
all
are.
about it. So, I love kids. I am obsessed with children. I think there's something so beautiful about and innocent about them. and working on them first. And as parents, especially parents who go through all of these mental health challenges,
Mhm.
I think that we can set up our kids to have the strategies that we need. And that is why, as a big, like, overarching thing, we did create Dr. Sensory, is to reach these everyday parents, is to reach these individuals that have questions but can also get them answered. And so we pride ourselves on, like, when someone reaches out to us either through like Instagram, Dr. Sensory, or our website, drsensory.com, that we're able to do the research for them and then provide those answers. And then I know how much, especially with like sensory processing, I know how much, even you mentioned the children that you work with autism and on the spectrum, so to say, and they have, like you said, you talked about those cushions, like those things are very practical strategies,
Mhm.
and we want people to know that more. And imagine those kids growing up and not putting themselves into that anxiety, depression cycle. And so finding the right therapy for that. So that is why we're very
Yeah.
excited. We're almost done with our software, and we're going to be able to provide therapy virtually for people who don't have access to it. And so this is like an inside scoop to where our business is heading. But it's almost complete, and that's the exciting part. Is I want parents to be like, my child needs something. They need the strategies to not get into the patterns that I've gotten myself into. Like, I need an occupational therapist, I need a speech therapist, can
Mhm.
someone help me? And just go directly to the website and be like, I found one within like 20 minutes. Like, that's a beautiful thing. And so I appreciate like you having me on here and speaking on like physical health with mental health with spiritual health. Like,
Yeah.
this is so heartwarming and so wholesome. And so
Mhm.
I appreciate the work that you do in this.
Thank you. Um, I when you wrote in and I read a little bit of like your purpose and what you, I was like, I have got to reach out to her as soon as possible. I have to have her on. And so I'm so glad that you agreed to, take some time to come on. Thank you for coming on to help me to continue to spread messages around breaking the stigmas around mental health. And I want to
Mhm.
congratulate you on all your business endeavors. It sounds really exciting. So I have to kind of follow you on Instagram so I can kind of keep up with what's going on. But yeah, thank
you're,
you so much
you're
again for coming on.
Thank you too. Mental health, everyone has it and everyone needs strategies, and you
Yeah.
are doing such great work, and I appreciate it. I was like looking through your work like, oh, this is awesome. I was telling my husband, look, there's one for parenting and fatherhood. So it's
Yes.
like, you got to listen to this. So that's awesome. You're doing
Oh,
great work.
thank you
Thank
so
you for
much.
what you do.
Thank you. All right, I'll be in touch with you soon to get you the links and everything. And again, thank you for taking your time out to be with me today.
Of course. Have a
Take care.
wonderful day
You
today.
too. Thanks.